Are you confused on what Medicare actually is? Well, you're not alone. A recent study came out and it shows that 49% of those who are eligible for Medicare can't identify the key differences between traditional Medicare and Medicare Advantage. And look, to be candid, it is complicated. So today we're going to go back to basics and we will give you an overview on how Medicare actually works. We'll provide an overview on the key differences between traditional Medicare, Medigap Plans, and Medicare Advantage, and we will provide you with some scenarios on which plan may make sense for you. Stay tuned, you're not going to want to miss this. So what is Medicare? Medicare is government-run healthcare that is generally made available to individuals who are lawful residents of the United States and age 65 and above. Now, Medicare, as it was designed in 1965, has a few key components. The first part of Medicare is Medicare Part A. Medicare Part A covers inpatient hospitalizations, skilled nursing facility care, hospice care, and in certain situations, home health care. It's important to note that for most individuals, Medicare Part A is free upon enrolling in coverage. The next part of Medicare is Medicare Part B, and Medicare Part B is designed to provide coverage for doctor's visits, outpatient care and preventive care, certain forms of home health care, and also some forms of durable medical equipment. Unlike Medicare Part A, there is a monthly premium associated with it, and while the premium does vary based upon your income, in 2025, the standard Part B premium was $185 per month. Now, while Medicare Part A and Part B sound great, they don't cover the full cost of the services that Medicare provides. There are, with Medicare Part A and Part B, deductibles and coinsurance that may apply, and as such, there are these things known as Medigap Plans that are designed to cover at least a portion of the 20% of the cost of services that Medicare does not cover. And if you wish to minimize them, the Medigap Plans can help fill in the gaps on what Medicare doesn't cover. Typically, you'll see that the plans vary by letter. They go A through D, F, which is not available for new enrollees, G, and K through N. Now, Medigap Plan G is the richest plan that's available to new enrollees because it essentially fills in most of the gap of original Medicare, and the only major form of cost sharing that those who are in Medigap Plan G will have to pay is the deductible for Medicare Part B of $257. As you can see on the chart, it does fill in a lot of things, but please note that Medigap Plan G does not cover your Medicare Part B monthly premium, nor does it cover vision or dental services or any other services that Medicare does not cover. The final part of Medicare is Medicare Part D, and you may have guessed it already, the D stands for drugs. With Medicare Part D, this is prescription drug coverage that is provided through private insurers. Similar to Medicare Part B, there is a monthly premium for it, and the overall average or standard premium for 2025 is $39 per month, but the actual premium that you pay will depend on the underlying plan that you decide to purchase from a private insurer. Now, you may have noticed at the beginning part of our video, we did not talk about Medicare Part C. Medicare Part C is known as Medicare Advantage, and it's designed to bundle Medicare Part A, Part B, and typically Part D all together in one consolidated plan design, and is provided by private insurers who receive money from the federal government to help manage your care. Now, Medicare Advantage definitely operates a bit differently compared to traditional Medicare. So let's go over some of the key differences between traditional Medicare and Medicare Advantage. Now let's talk about the network. With traditional Medicare, most providers do accept Medicare along with most hospital systems in the US. It is important to note that as long as your specialist accepts Medicare, there is no requirement for referrals, and typically no prior authorization is required either. Let's compare that to Medicare Advantage. With Medicare Advantage, it's typically limited in terms of the doctors and hospitals who accept it. Referrals may be required if you happen to have an HMO version of Medicare Advantage, but if you have a PPO version, a referral is typically not required, and prior authorization may be required if you happen to have the need for expensive care. In terms of the plan design for Medicare Advantage, it may look like a traditional or under 65 design. Typically, you'll see that most of the cost is covered with the exception of nominal copays and coinsurance, but note that this varies from one health insurer to another. Prescription drugs are usually bundled together, as we mentioned before, and often you'll see that dental and vision coverage is included, along with, in certain instances, coverage or discounts on gym memberships. In terms of out-of-network coverage, PPO plans provide up to 50% coverage for out-of-network care, and HMO plans by design don't provide any out-of-network coverage. Lastly, note that Medicare Advantage typically provides an out-of-pocket maximum, but this out-of-pocket maximum will vary from insurer to insurer, and ultimately the level of richness in terms of plan design that you ultimately select. Now, the final piece of the puzzle is the cost of coverage. With traditional Medicare, in terms of the Medigap premiums, the Kaiser Family Foundation has reported that in 2025, the average Medigap premium is $217 per month. In terms of Medicare Advantage, that average monthly premium is significantly less at $17 per month, though it is very common to find $0 premium plans available in the marketplace. So John, when does traditional Medicare make sense for me? Well, the most common reason why many people pick traditional Medicare coupled with Medigap plans is they don't want to be limited by a network that is more narrow than traditional Medicare. So if you want the freedom to see any provider that accepts Medicare, traditional Medicare coupled with the Medigap plan can be right for you. So let's talk about some of the reasons why Medicare Advantage may make sense for you. The first reason is, let's say you've missed the 6-month sign-up window for Medigap coverage when you first become eligible for Medicare Part B. In that case, you might find that you might be denied coverage based on your health status, or if you are able to enroll, you may have to pay a significant surcharge in order to purchase a Medigap plan. In that particular scenario, it may make sense to purchase a Medicare Advantage plan. Another reason is that a top-rated plan for Medicare Advantage is available in your area. Each year, CMS does studies, and based on patient feedback, they rate Medicare Advantage plans. If a plan in your area happens to have 4 or 5 stars, it may be worth considering during open enrollment. Another reason could be you wish to take advantage of the low monthly premiums, and all the doctors that you happen to see do accept that Medicare Advantage plan that is offered to you. The final reason is you expect to stay close to home and don't have a lot of traveling. If you happen to be a snowbird, where up north in the summer and in the fall and winter you go down south, a Medicare Advantage plan might not work for you because it's designed generally to provide localized healthcare services. Now, we want to hear from you guys. If you're considering signing up for Medicare, would you be most interested in picking a Medigap plan or a Medicare Advantage plan? Comment below.